This is going to start with me cracking up.
So we're live on the NTA Facebook page. I'm Shelley Gawith here in New Zealand. It's morning time. Dr. Jolene Brighten is in Paris and it's 8 p.m. nighttime for her.
There's the sparkly. Can you see it? Oh, the Eiffel Tower. Look at that. Like Live messed with us, technology messed with us, and now we have the sparkly Eiffel Tower.
Yes. Oh. That's why it's with us, because we wanted the sparkles in the background.
We planned it. We planned it this way.
And it's lunchtime in Portland right now in America. So we've got all the different countries going on, so many different time zones right now. But I am very excited to be talking to Dr. Jolene Brighten this morning. So Dr. Jolene, this evening for her, is a functional naturopathic medical doctor and a nutritional biochemist with a focus on women's endocrine health. She is recognized as a leading expert in post-birth control syndrome and the long-term side effects associated with hormonal contraceptives. Dr. Brighten is the author of Beyond a Pill, which I can see just behind her, and I'm very excited that it's in the screen. Yeah, we're getting to see it first. And it's a 30-day plan to support women on birth control, help them transition off it, and eliminate symptoms of post-birth control syndrome. She is a speaker, an amazing one, a women's health advocate, and a medical advisor for one of the first data-driven apps to offer women personalized birth control recommendations. Thank you for joining us today, Dr. Jolene.
Thank you so much for having me. And for people who are watching, know that Shelley and I have known each other for years. And in fact, it was an NTA conference that my husband met you. He was like, this girl is awesome. Let's have breakfast with her tomorrow. And then we went and then we had breakfast together and we hung out. And I was like, I love her. So it's super exciting.
Has changed my life. So anyone going to the NTA conference this year, it's not just about the speakers on stage. I actually just met, like Dr. Jolene just said, her husband. We started chatting, had a great time. Next minute I'm meeting Dr. Jolene and we formed this friendship. So I'm super grateful. And Dr. Jolene, I'm super grateful for all the work that you're doing and bringing into this world, because you've transformed the work that I can do with my clients, and I don't need to reinvent the wheel, because you've done it so well and you're so brave and courageous and bringing this against all odds to the world. So can you quickly tell us, before we delve in, a little bit about Beyond the Pill? It's released at the end of this month. How can we get it, and what was your drive for doing it?
So grab it on Amazon, Barnes and Noble, any places books are sold. My drive for doing or writing Beyond the Pill was really my patience, because, I developed post-birth control syndrome. I did a decade on the pill, super grateful to have that tool, first generation college student. But, so many of my patients were coming to me with birth control side effects and not understanding how it was affecting their body and developing post-birth control syndrome. And it was with them that we partnered. We, together developed these protocols for post-birth control syndrome. And really, the book it's called Beyond the Pill because I wanted to give women solutions beyond hormonal birth control. Like, you can go to a doctor with any female problem, and it's the pill for every female ill that they will pass you. Like, I know you'll get hormonal birth control, but I really wanted women to be able to have some root cause solutions to their hormone imbalance symptoms, to understand what those mean, what they should investigate, what lab testing they should have done, and what to do right away to turn those symptoms around. But also understand, if you do want to use hormonal birth control, how do you take care of yourself on it? How do you watch out for the side effects? What are the side effects, and what should you know? I mean, when I was passed the pill, it was like, here's a brown paper lunch bag full of hormonal birth control, and nobody really talked to me about the symptoms and side effects. And I think that's a big disservice to women. We have a right to know, if we're going to pop a pill every day, what is that doing to our body? The other reason it's called Beyond the Pill is because I want women to know there is life beyond hormonal birth control. When you come off, maybe it's not all sunshine, rainbows, and unicorns, but it shouldn't be hormonal hell. And so I want to guide women in, how do you successfully use hormonal birth control and transition off when you're ready with that?
Perfect. You've given us so many nuggets that we're going to go deeper in right now. You've opened the box for where this interview is going. With the audience that we've got today of NTA, they're mostly practitioners or just training to be practitioners. So they're either on the pill or they're working with clients and patients on the pill.
Mm-hmm.
So do you want us, and I'm all too familiar with listening to clients telling me that they just went into the doctor's office, the doctor gave them the pill, they were never told any side effects, they were never told what wrong or what could happen or how that could affect them when they wanted to get pregnant later in life. So tell us, what are some of the, right off the bat, what are some of the side effects of going on the pill?
All right. So if you are an NTA gal or, well, person, but like most of us in healthcare are women, nutrient depletion straight out the gate, like depleting things like folate, B12, zinc, selenium, magnesium. I mean, these things that we need to like run liver detox, make our brain work, make our gut work, our thyroid work, our adrenals work. Like, I mean, these nutrient depletions alone affect every single system in our body. Not to mention that hormonal birth control, like it lowers microbial diversity to the effect that researchers have compared it to antibiotics. Now, I don't know about you. I don't know anybody who spends decades on antibiotics, yet we spend decades on hormonal birth control. There's also the issue that like it impacts liver detoxification, not just the nutrient depletions, but structurally and genetically, it alters our liver's function. And then it hits our adrenals, it hits our thyroid, it hits our vagina in terms of causing, yeast infections. It can cause vaginal atrophy. It can cause pain with orgasms, pain with sex. And we certainly see mood symptoms, which are correlated, like anxiety and depression. So, every single system of your body is impacted by hormonal birth control.
Totally. And like, if you knew that, how many of us would really take that pill? Like, there are so many alternatives, but it's not like the doctor says, here's the pill, here's all the side effects. What are you going to do? Mm-hmm. They just hand it out. So you touched on something. A lot of people, and in New Zealand and Australia, it's our biggest thing at the moment. Our biggest health crisis is thyroid health. How does the pill impact the thyroid?
Oh gosh, this is so big that there's an entire chapter in Beyond the Pill just about thyroid health, because it's like every single place that your thyroid goes to function, or the whole system, the hormonal birth control can impact. So, we first have to understand TSH is a brain hormone. Thyroid stimulating hormone is how we talk to our thyroid. Our thyroid should produce T4, little tiny bit T3, but most of that gets converted in our bigger organs and our peripheral system. So with that, what you need to make thyroid hormone, those nutrients are depleted when you're on hormonal birth control. Then the organs that need to convert T4 to active hormone, which is T3, which is your mood, your menses, your metabolism. So your liver, hit by the pill, your gut, hit by the pill. We could just keep going, that all of these systems are hit by the pill. And so the conversion is impeded. Now, even if you can convert it and you make that free T3, it gets to your cell, but hormonal birth control is inflammatory. It makes the cells rigid. Now the cell can't actually take up that thyroid hormone that you did make. And then another layer is thyroid binding globulin is increased while you're on hormonal birth control. Now, some researchers, you'll read these papers and it's kind of cute, where they're like, hormonal birth control actually leads to higher levels of thyroid hormone. Right. Total thyroid hormone, because all the stuff you actually use is bound up by thyroid binding globulin. And there's some people out there that will be like, that's not a thing. Okay. Except that when you're on hormonal birth control and you're in a trial, they are measuring things like sex hormone binding globulin, thyroid binding globulin, and cortisol binding globulin to understand that you are actually taking it. That's how they validate you're taking it, because it's known that these proteins that bind active hormones are elevated with that. So there's a lot of ways that hormonal birth control can impact the thyroid. And that doesn't even touch on the autoimmune component, which I detail in the gut check chapter of Beyond the Pill, of how, hormonal birth control may very well contribute to autoimmune disease, which is something I've seen clinically. There is some research on certain autoimmune diseases that very well do validate the woman's experience. But we are and you'll hear me say this with so many things, we need so much more research, not only with birth control, but in women's health in general.
Yeah, totally agree with you. So if you are on the pill and then you suddenly stop being on the pill, can we expect side effects? Are there symptoms? Like, can you just one day decide that you don't want to be on it anymore and life's just going to continue on as it always has been?
Yeah, I thought that. And I stopped the pill. So I did the pill for 10 years. I'm a first generation college student because of it. So I can be thankful for that tool. But, when I was sitting in medical school and learning about all of this, and like, when do we learn about when we can actually get pregnant? When we want to get pregnant. So I was learning about fertility, and they're like, oh, you can get pregnant. Like, a woman's fertile one day out of the month. And I'm like, wait. I've been suppressing my hormones every single day for 10 years, and I'm fertile one day out of the month. So I stopped. When I stopped, I developed post-birth control syndrome. So for the first time in my life, I had cystic acne. We're talking about like I had a beard of cystic acne. I never had that before. And my period went missing. And I thought I was a freak. My doctor was super good at being like, yes, you are a freak, because I've never seen this before. And he actually said to me, it's likely you have PCOS. You always had PCOS and you didn't know it. And I'm like, no. My periods have always been regular. And he's like, no, you're misremembering. I'm like, okay, except if you are a woman who bleeds for 7 to 8 days out of every month, you're clenching that Midol bottle, popping those pills. You're like, okay, has it been 6 hours? Can I take it again? And you have a hot water bottle or a heating pad against your abdomen. Like, I counted down my period like doomsday was coming every single month. And I did that for a good 3 years before I started hormonal birth control. So when my doctor was like, you're misremembering, that was a moment where I was like, why are you mansplaining to me? Now, mansplaining was not a term that we used back in my day, but for real, I'm like, how does this man who doesn't know my body is telling me that I don't know my body and I don't know what I'm talking about? And he was like, you probably have PCOS. And as you'll read in Beyond the Pill, I talk about how women can be misdiagnosed with PCOS when they come off of hormonal birth control, because your androgens can explode. Those male sex hormones, which by the way we have, that are awesome, they can come back. And it's not that they're coming back to betray you. It's they're coming back because it's like the first time that they get to actually be on the scene. The other things is not like, so acne, not uncommon. Losing your period, not uncommon. And these are things that go along with post-birth control syndrome. Post-birth control syndrome it's the collection of signs and symptoms that develop on average, within 6 months of stopping hormonal birth control. It can take longer because as ladies, we like to be like, yeah, that's an issue, but I can deal with it. I can deal with it until you cannot deal with it. And that's what's tricky, is that it may be a year or two later and your doctor's like, well, that has nothing to do with birth control, because they never took the time to ask you about your timeline and like, what did it look like to come off of that? So, with hormonal birth control, we can develop things like gut symptoms, mood symptoms, skin symptoms, liver symptoms, symptoms of poor detoxification, vaginal symptoms, sexual symptoms like pain with intercourse. You can have vaginal atrophy, you can have yeast infections. There's a lot of ways this can present, including weight gain. I mean, right now we're talking, it's January. I don't know why still in 2019, we come roll into January and everyone's like, let's lose weight. And it's like, seriously, there's so much more going on with our weight. And anyone who tells you it's calories in and calories out, like, can they just go back to like the 1990s? Like, that bad nutrition information needed to die like yesterday. And I say that as someone who is trained in nutritional biochemistry and as a clinical nutritionist. There's still people like on Instagram who will tag me and be like, Dr. Brighten will tell you that your hormone imbalance may be due to mitochondrial dysfunction or to hormone imbalance or to, gut dysfunction. But I'm telling you, it's because you're eating too much and you're not exercising enough. And I'm like, okay, honey, can you slow your roll and read a scientific research paper? Because that needs to go away. And especially like, it's always like a man who's coming on and being like, oh, your hormones, ha ha ha, you want to blame them on your like your weight gain. And that's something I always come back with, like, how do you explain hypothyroidism then? You know, that thing, that free T3, that's your actual metabolism. And like when I was hypothyroid and no one had diagnosed me yet, and I went from having a baby to, by the time I was diagnosed, I couldn't even fit in my third trimester clothes because I gained so much weight. They ain't got anything to say to that. And to that, I'm just like, look, you take your old story and you're bagging on women and you take it back to the 1990s because nobody has time for your poor nutrition education.
Totally. It's so true. I've been there as well. And they look at you and I see the amount of clients come in and they're crying because their doctors just told them they should exercise more or they should eat less. And they're like, I couldn't eat any less if I tried. And I am trying to exercise. And it's like, that is not helpful. So, and you touched on a really good point as well now, Dr. Jolene, is the birth control pill a common symptom, and I see this in clinic, and you've obviously seen it with so many of your patients, weight gain. Nobody is telling you that that's a side effect. So how does that work? What is the connection there?
Oh gosh, you know, I love when I read the research papers that are like, oh, hormonal birth control causes mild weight gain. It's only like 5 or 10 pounds. And I'm like, okay, hold up. I'm not even 5'5". So if I gain 5 pounds, that's a lot. 10 pounds, that's a lot for my frame. Like that is noticeable. So, you know, part of it is definitely weight gain. Hormonal birth control is inflammatory. It shuts down progesterone. Progesterone is your natural, awesome hormone that's a diuretic. And instead it floods your system with progestin, which really does no favors to anyone except for like you don't get pregnant. So yay for that. Everything else, not so much. So, you know, with that, it can be weight gain. Weight gain to like due to fluid retention, inflammation, and it can also be because of the impact on your thyroid, on your adrenal glands, and on your estrogen overall. So fat cells love themselves some estrogen, and estrogen stimulates fat cells. And then they're like, yay, let's plump up, let's get fatter, let's produce even more estrogen. And the cycle just continues. But also, you know, everything I explained about the thyroid, if your thyroid's not functioning optimally, you will never lose weight not because your body's betraying you or something's broken in that mechanism, but because if the thyroid is low, it's like historically speaking, so we can look at like Irish descent. So went through a famine. Who survived the famine? People with low functioning thyroid, hypothyroid, because they could live on 800 calories a day through a famine. And so that was a bottleneck situation where like that population came out, like they went through that and now, okay, most of the population is hypothyroid because that was a survival mechanism. Like your thyroid, like your body always wants you to survive. So your thyroid will down regulate in order for you to not have to expend as much energy, to not have to eat as much. It will compensate in those ways. The other thing is that with cortisol, so hormonal birth control, it's inflammatory. They've done studies. They take your blood, CRP, fine. You start the pill, CRP, elevated. That's a blood marker of inflammation. Now, if we have inflammation rise, cortisol has to come up, not because cortisol is bad. There's some people out there that will be like, cortisol causes belly fat, it's the worst. Okay, belly fat is the worst. Nobody likes a muffin top. I can acknowledge that. But at the same time, if cortisol comes up, it's because there's inflammation taking place and because too much inflammation is a really bad thing. And so we have to recognize that like our skin, our weight gain, very benign, but your liver, your heart, your gut, your brain degenerating, like nobody survives through that. So your body will always say, how can we keep you safe? We want to keep you safe. And that's really what it does. But, you know, research is quick to dismiss. I mean, research, medicine, science is quick to dismiss women altogether. Why? Because my hypothesis is we are complex and like research wants it clean. They want to be like A plus B equals C. And in a woman's body, it's like there's A sub A sub A. Like there's all of these other things plus B plus all of this. And like We are complex biological systems. And as we roll into the future of women's medicine, if you cannot step up to accept that we are complex biological systems, which means that you're going to have to do a little more work, you're going to have to respect that individual, you're going to have to respect her story, then you really got to ask, like, is women's medicine the best thing for you? Maybe not.
Totally. And we are complex. That's the joy of us. That's why it's the beauty of being a woman, and also the downfall at times too, because like you say, they don't want to do the research. We're not simple A plus B equals C. We're like this, throw in a few more hormones and we go even more like this, and throw in our family life and everything else. And the fact that women often take on a lot of extra, like nothing about us is equal, which makes us awful. Research, in terms of research, linear, doesn't make us going to be great subjects for it. So they don't want to go near it. So
they just started like studying us like yesterday. Like most people don't realize that like the FDA was like, study a man, try a drug on a man. And like, who are these men? They're usually like college age men who are going in for these drug trials. And then they're like, and then take all of that and say, women, same. And it's why like, medical gender bias is being really well recognized. Medical schools are starting to change. Thank goodness for that. But the other thing is that you could walk into the hospital. So I'm having a heart attack. This man's having a heart attack. We walk into the hospital. I am more likely to be told, girl, it's all in your head. Go home. And then you die. And this man gets the treatment he needs. Why? Not because your doctor is a bad doctor, not because your doctor is betraying you, but because the research is like, this is what heart attacks look like. You see this little box? If you don't fit into it, that's not you. And what we've come to understand is that women present differently with heart attacks. We present differently in a lot of ways. And it is like, I hate to use the word stupid, but it is really stupid to think like, oh, here's a man. That's the same thing as this organism that creates life in its body. Like we birth the entire human race. The species is here because they came through the vaginal canal through a woman, maybe a C-section, but either way, they came through a woman. And to think like, oh, this woman is exactly same as a man, that doesn't make any sense. And at the same time, that's not saying anyone is the lesser. It's just saying we're different, and we need to acknowledge that, and we need to pursue the research that serves both genders.
Totally. Your fight and Beyond the Pill is so much more than just Beyond the Pill. It's women in general, and us being not equal, differently equal, but getting all the research, getting the acknowledgements, getting the fact that we are totally different to men. Like you say, we birth a whole nother generation. We birth the planet, and we have a whole heap of other things going on that men don't have. And you're right that it's the college-age students. They're not affected in the same way by hormones, and then they're not throwing in birth control and everything else into their bodies. So does birth control impact the libido?
Man. That is ultimately, I mean, that's at the core how hormonal birth control works, right? Is that you get on it, you're like, I'm going to have sex. I'm going to take this hormone. I don't have to worry about getting pregnant. Oh, snap. I have no libido. I don't even want to have sex now. How are you going to get pregnant? You don't even want to have sex. So yeah, we've come to understand through the research that hormonal birth control alters your liver at the genetic level. Like it increases that sex hormone binding globulin. If you guys missed that, rewind this, go back and watch the beginning when we started talking about this. So sex hormone binding globulin, exactly what it sounds like. It binds onto sex hormones. And so it does this to protect you because you're taking enough hormones to shut down how your brain and ovaries communicate. And so the liver does this to keep you safe so you don't get overstimulation. But ovaries have already diminished up to 50% of testosterone. Sex hormone binding globulin then grabs onto the other testosterone that you have available, and now you have no libido. Not to mention that hormonal birth control can cause pain with intercourse, vaginal atrophy, if you do actually want to have sex and you have an orgasm, you orgasm. Like, that's super lame. Like, that is like the worst. And then you can be susceptible to infections like yeast vaginitis. And if that's going on, like, you don't feel sexy, you definitely don't want to have intercourse because the tissue is sensitive, and that starts up a chronic pain syndrome. And so even though women will come off of hormonal birth control, they may not. So research has actually said, like, you probably won't get your sex hormone binding globulin back to those pre-pill levels. I will say, Epigenetics for the Win, we've done this clinically, and I outlined the protocol in my book, Beyond the Pill. The other piece is that if you've been having pain with intercourse, then you might actually be adverse to intercourse. And so you might lose your libido because you are now associating sex with pain. And that's where, like, working with a pelvic floor physical therapist can be so beneficial in helping you break that pain pattern.
Totally. And I'm so glad that you said that, because it is breaking that pain pattern as well. You can do everything, and your protocol will mention it in your book, to do everything right nutritionally and within your body and getting your liver and thyroid and everything functioning again. But you do need the structural work at times with working with a pelvic floor physiotherapist or practitioner to really help do that as well, which can sometimes be the missing link that people aren't really talking about. And you kind of think, oh, I haven't given birth, or, I had no problems with my pregnancy. What do I need to go and see a pelvic floor expert for? But I know that more people than they realize really need to be going to see the pelvic floor expert.
You know, what's crazy right now is that my first book, which was Healing Your Body Naturally After Childbirth, I talked about how in France, they actually prescribe 10 or more sessions of physical therapy after you have a baby. And it's like, they just call you up. They're like, you had a baby. When do you want to schedule your vagina rehab? Because it is that important to your long-term health. And here I am sitting in Paris, France right now as we have this conversation. And I'm like, of course, here I am. We're talking about libido. We're talking about sex. And I'm sitting in a country that totally gets it.
Totally. But you know what I love the most is Vagina Rehab. I'm totally going. This is coming into clinic with me next week. Thank you, Dr. Jolene. I'm going to be like, let's talk about your vagina rehab. We need to get this sorted. I remember reading that in your first book too.
I know, but like when you pass a small human, it's like, okay, so not every woman has had the benefit like I have of looking at a lot of vaginas. And like when you are going through and learning how to do, pap smears, and I've done a lot of pap smears in my time, like you see there's a different speculum you use if a woman has never had a baby versus had a baby. And when you see a vagina that's never had a baby, and if you've never had a baby, get a mirror and look at your vagina, because you should be in the know on all your business. But when you look at that and you imagine like a head came through there, like you can understand that like those muscles are going to experience some trauma. And when I say head, it's not my size, although I do have a very small head. But when a head passes through the vagina, like there's a lot of trauma that happens to those pelvic floor muscles, especially if you work with a doctor or a birth provider who's like, push, 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 push. That can be a lot of trauma. I mean, birth is traumatic for the body in a lot of ways. And what I always find ridiculous is like, if somebody runs a marathon, people are like, you should rest, take it easy. If somebody has a baby, they're like, why haven't you done the dishes? Why is your house a mess? And it's like, that is like arguably the like biggest athletic event that the human body can possibly go through. And yet you're dogging on her like that. But that again is just one more piece of women's medicine where we don't hold space. And it's like, if we were in tribes years ago, like the wise woman would have stepped up to somebody who said that and be like, no, she ain't getting up. And you better, like, before you run your mouth, why don't you save your energy that you're running through your lips and put it into your feet and go get her something to eat? Like, it would be a very different scene. But today it's like, we're supposed to do everything and be everything at all moments of the day. And, like, again, like what you said, the human race wouldn't be here if women weren't so adaptable, if we weren't the ones who put everyone else first and cared about everyone.
It's so true. So is the dream, just so we're clear for everyone, to not be on the pill, not taking the pill? Or is the dream to, from your point of view, with the pill and getting this with your book and getting this education out there? Or is it that there are times that it's appropriate to be on the pill, but here's all the information to go with it? What would you like in an ideal world? What is your passion, and where is this all coming from? What do you want? What would be the dream?
I want women to have all the information that they need to make the best decision for themselves on an individualized level and know at the end of the day that 100% that was the best decision for them. I think this cookie cutter model of like we pass one thing to every single woman, it's not working. We understand that. And I would never advocate that we take away hormonal birth control or any form of contraceptives from women. And instead, what it really needs to be is an individualized dialogue with that woman, that she gets all the information she needs. She knows how to take care of her body, whether she chooses hormonal birth control or not. But at the end of the day, it's her body, it's her choice, and she should be supported in whatever she chooses.
Totally agree and totally love this. So anyone that's sitting, that is on the pill now, does not need to feel bad, does not, once again,
No.
It's not about, like, women forever are getting more messages about, you're not doing this right, you're not doing that right, do this, do more of this, you've got to do this, Wonder Woman. That's not your message at all. It's very much like, here's what you're doing. If that's working for you, at least have all the education and the information. So you're making the best choice, and you're really about empowering women and their health.
Totally. And, I did the pill for 10 years. And there's people who are like, well, if you had to do it all over again, would you have not taken the pill? And I'm like, how can I say that? I'm a doctor. I'm the first person in my entire family to go to college, and I became a doctor. And like, in that process, like, I don't know what that would be a totally different trajectory. But when I was on the pill, I wish someone would have explained to me, like, driving through that fast food window is not doing you any favors. In fact, you're on a medication that's depleting nutrients. Maybe you want a multivitamin or prenatal, and also your diet is non-negotiable. You better get on that. Make sure you eat your vegetables. Like, it's things like that. And really, writing this book, I have women all the time who are reaching out to me being like, I wish I would have known you when I was 17. And I'm like, I wish I would have known me when I was 17. But it's about, women understanding their body, because, this book is more than just birth control. It also talks about, like, there's a chapter I call the Dakota Ring, which is like, when you got your period, you should have gotten this chapter so you could decode what your period was telling you. Like, that menstrual cycle is rich in data, and you can leverage that to understand how to reverse those symptoms, but also where's your body going and how to head it off at the pass so that you don't develop more chronic conditions.
Totally. And I love that as well, because I always say to clients, like, often we can think of periods being our worst enemies, right? If you have, like me and you, where you've had horrible periods, whether it's like the amount of blood you're bleeding and shedding, the pain, me wanting to like collapse and faint every single month or whatever, it was like a living nightmare every single month. But now we both know, and your message is very much, our periods are girls' best friend. Like, they are a free health checkup every single month with what's happening in our bodies. If something's out of sync, taking the pills just suppressing or hiding whatever's going on in our bodies. But if we can unpack it and say, hey, why is this out of balance? What is happening? It's our body talking to us. It's a free health checkup. Yeah, the medical world and so many people are so quick to just dish out the pill. Take a pill. It's going to make it all better. You've got one piece of acne. Take a pill because that's going to fix it all. And it's like, no, let's learn.
Yeah, like the pill will fix our periods or fix our hormones. Like, that is like something that, like, I'm still explaining to people is like, hormonal birth control is designed to shut down your ability to make a baby. That's your entire reproductive system. How can it fix that when it's shutting it all down? Like, and it cannot fix the root cause of your symptoms because it's a medication that's strong arming your body into submission. Is it your right to use it for symptom suppression? 100%. But you need to know about the side effects so you can safeguard your body. Like, the worst thing is to be like, oh, my doctor passed me the pill. I did it for decades. And now, oh, I have endometriosis. I have PCOS. I have thyroid disease. To which so many doctors are like, oh, yeah, that just happened like right now. And if you go through somebody's timeline, it's often so clear that that was present. That's the reason their doctor put them on hormonal birth control, which is disservice. You never asked why. That's your job, is to ask why, to understand what's happening and to help her safeguard her health, not just manage the symptoms. I mean, I think everybody listening right now, they're in the NTA program or have gone through it because they recognize that like people want root cause resolutions. They don't want another Band-Aid. Like the Band-Aids have been failing us. Like you ever put on a Band-Aid before and walked around and only lasts for so long and then it falls off and then you got to deal with it all over again. People are waking up to this and women are certainly waking up to it.
So, and I'm also a little bit passionate about this topic, as you know, Dr. Jolene, but also, is there a risk or is there a connection between the pill and cancer? Has there been any sort of connections with that?
Oh yeah, definitely. And there's a chapter called Metabolic Mayhem, which is in Beyond the Pill, where I talk about cholesterol, heart disease, stroke, blood clots, but I also talk about the cancer risk. And I weigh it in terms of like, yes, endometrial cancer is less, but cervical cancer is more. And is that due to HPV or something else going on? And yes, or ovarian cancer is less, but breast cancer and liver cancer is higher. And so that women can start to understand, because you know, doctors will prescribe it and be like, oh, you have a family history of ovarian cancer, take the pill that will lower your risk. But like, we understand so much in 2019, while we talk right now about epigenetics and how to lower cancer risk, that like, there are a lot of ways to lower cancer risk. And it's sad to me that that's the only tool a doctor has to pull out in that. But you have to go through that chapter, go through a conversation with your doctor, go through your family history and understand there are increased risks of these, you know, certain cancers. Some are lower. And what I find just crazy is that, you know, with like breast cancer, for example, doctors will say, well, it's a mild increased risk. Stroke is a mild increased risk. And it's like, we're not talking about acne and hair loss, okay? We're talking about life-threatening diseases. So while statistically speaking, it's a mild increased risk, we also need to recognize that it's a life-threatening risk and it carries a different weight with that.
Totally. And I'm so glad that you brought that up, that there are different weights to the different risks. Some are more mild. And, you know, maybe it is a bit of hair loss, but to some women, that can be a huge thing. Or maybe
hair loss is a huge thing to all women. All women.
I agree. The amount of clients that come into clinic and they're like, I know that, you know, this shouldn't be, and I'm just being vain. And I'm like, no. It's a big deal to every female client. I gotcha. Really? It's not being bad. Yeah. And plus, it's a sign that your body's out of balance. So we'll go with it anyway. It's perfect. Mm-hmm. So why do you think that Western medicine isn't talking about this? Why isn't every doctor's office, if the doctors don't have time, why don't they have your book sitting there with the pill, or Lara Brighten's book in New Zealand sitting there with the, like, why aren't those resources out there? Why isn't the Western world and Western medical world pushing this?
Yeah, well, so I just want to say that Lara Brighten, Brighten, and Dr. Brighten, Jolene Brighten, our books are going to be next to each other on the shelf. And we're really excited. We're like, they're going to be sister books. And everybody gets us confused. And it's actually hilarious because she's like, well, we both have brown hair, but mine's straight and yours is curly. I'm like, it's not even about that. People are just like, you guys are talking about this stuff. When we found each other, it was like this glorious moment. But, you know, with that, there is this, there's this thought that questioning hormonal birth control is questioning a woman's right and the women's movement and women's liberation. And I think that maybe that was true at one point, but at this point, the most anti-woman thing you can do is not question this. And it's because we haven't been questioning it. We haven't seen iterations that have done better for us. And, you know, the other piece is that doctors only know what they're educated in. In medical schools, they are recognizing the clear medical gender bias. They are taught in medical school that you just give hormonal birth control for all of these female problems, these period problems, and that's what's in their toolkit. It's not because your doctor doesn't want you to do well. It's not because they're betraying you. The analogy I use is like, if you go to a sandwich shop and you ask for ice cream, you're both going to get really frustrated when you keep demanding ice cream. They don't make ice cream there. You're asking for ice cream. You need to go to the ice cream shop. And so, you know, conventional medicine, Western medicine absolutely has a place. Super, super grateful to them. They are amazing at acute care. But when it comes to root cause resolution, that's not really their forte. And that's not to blame them at all. And it's just to say that, like, if you're frustrated with your doctor, leave the sandwich shop. Go to the ice cream shop and get that gelato you've been craving. And you just may have to go somewhere else for that. But I mean, that's a big part of it. And I think the other part too is that, you know, a lot of medical education, a lot of, I mean, I just went through this, like Beyond the Pill. I probably won't be talking about it on any major media outlet because, you know, these pharmaceutical companies, they sponsor a lot of these things, and people get really afraid that, like, if you're questioning something, that must mean you're anti something, and then you're going to hit the bottom line on things. And that's not really what it's about. That's not what my message is about. It's really about, like, hey, I'm super grateful I had the pill. A lot of women are super grateful they had the pill. Let's put them in the know that if they want to use hormonal birth control, they can keep their body safe. And hey, by the way, can we all work together to, like, fine tune this, to make some better options for women, and to make sure that they have all the resources that they have so they can stay safe on it and they can thrive with it if they choose to use it, because that's 100% their choice.
Totally. And I love how you say it, working together, and also the analogy of the sandwich shop and the ice cream shop. It's true. If you go to the sandwich shop and you want an ice cream, it's frustrating for everyone. So there is a responsibility on us as well to be really informed and get the knowledge, go searching for it, read books like yours that you're putting out there, get information, support each other. And really, sometimes as women, we can be fast to criticize each other rather than going, actually, it's okay. Like, she's doing her thing, I'm going to do my thing, and we can all share information and support each other as well, because that is also how the Western medicine world works too, where if they keep us all fractured and not supporting each other, they can keep winning as well, because we're kind of doing their work for them. Because women can be so hard on each other as well and be like, don't do that, do this, blah, 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 rather than being like, you know what, let's all just help each other, share the information. She wants to have the pill, that's great, but have you thought about this in a non-judgmental way? We can be so fast.
And it's 2019. Can we all just make a pact that, like, we will know what's best for our body and we'll own that truth? And then whatever our sister, mother, best friend is doing, that we'll support them in whatever their decision is. But, like, this idea that you know how to live anyone else's life better than your own, or that, like, you know someone else's body better than themselves, like, that's just silly. Like, and instead take all of that energy that, like, and very much, I mean, what you're touching on, it's like, don't feel ashamed if you're someone who's ever judged another woman, badmouthed another woman. We've all done it. Like, we've all done it. And, like, those roots run deep, like back to when, like, the word witch became this dirty term, in which, like, it was a situation where it was like, call her a witch, then they ignore you, they kill her instead. Like, there is a dark, dark history in women's lineage altogether. And so understand that those roots run deep. So if you're ever propelled, or, like, you ever feel the need to do that, just sit with it. Where's it coming from? What is it serving? Because odds are it's not serving you, and it's not serving any other woman.
It's totally true. And the like you say, it's not serving us at all. So, Jolene, a lot of people will go on the pill because they don't want to get pregnant, right? Then they might have been off without even thinking about it for 10 or 15 years. They want to come off it. How is the pill? And then they want to get pregnant because we want to do stuff straight away, right? Like, once we've decided we're going to, like, our body should jump to it and we should be pregnant. Like yesterday, right? Because that's totally how we think. So is the pill impacting fertility? What is the impact? What is it doing? Can we be on it for 15, 20 years, come off it, and suddenly get pregnant?
Gosh, we need so much research in this arena. So reproductive endocrinologists have noted this phenomenon in which, the same mechanism that's hypothesized to lower the risk of endometrial cancer may be contributing to an inability to maintain pregnancy, which is that you downregulate estrogen and progesterone receptors in the endometrial lining. And so you can't actually build up the endometrial tissue. And in Beyond the Pill, I have an entire chapter just about fertility and what you should do to get pre-baby body ready, as I call it. Now, with that, so there's that piece. There's also this understanding that some women, they can get pregnant right away. Not every doctor wants to tell us that, but some women, it can take them a year and a half to 2 years before they start ovulating again. So if you want to get pregnant, let's say you're 38, you need to get off the pill because it could take you a couple years to start ovulating again. Now, if we understand as well that hormonal birth control, it impacts the microbiome, impacts your nutrient status. Like there's a whole lot of reasons why you want to spend time really building up your body before you get pregnant. Now, in 2018, a study came out that showed that if you get pregnant within 6 months of discontinuing hormonal birth control, your baby is at higher risk of childhood cancers. Now, is that to say that like you did something wrong? No. Okay, that's not to say that at all, but it's to say like there is a reason to pause there. Why could your baby be at risk for childhood cancers? Like there's a lot of reasons, but the microbiome is a big part of that. That sets the stage for baby's immune health. And we know that hormonal birth control lowers microbial diversity. So we do want to replenish nutrient stores. We want to take care of the gut. We want to make sure the liver's detoxifying. We want to be as healthy as possible, no matter if you've done the pill or not, or any form of hormonal birth control before you get pregnant. Better pregnancy, better baby health, better postpartum. Like everybody wins in that scenario.
Totally. And I always say to female clients, this is the greatest gift that you can give to your newborn baby is sorting out your health, like on a giving to your baby in the future, but also on a selfish level, sorting out your health before you get pregnant, whether you're on the pill or not, or being in the best possible health. As a mom, we want to set our babies up for the best health ever. So wouldn't you want to do that first? Like give them the best chance. You know, it doesn't matter, like life comes at us and there's all sorts of different things once baby's born. But why wouldn't we want to do that, whether we've been on the pill or not on the pill? Set them up. So, but also a lot of clients will come into clinic and we've done with like all sorts of research and stuff. What's the connection between the pill and like brain fog, fatigue, like, you know, mum fog, baby's brain, all these things that we hear about? What is there? Is there a connection between it?
Totally. So, I mean, just by, and if you guys missed this, go rewind it, listen to the thyroid bit, but just by downregulating thyroid function, utilization of the hormone, that can lead to brain fog, inflammation. The pill is inflammatory. That can lead to brain fog as well. It is known to disrupt the tryptophan pathway, which is how we make serotonin and eventually melatonin. It also depletes antioxidants and nutrients that your mitochondria need to function. Mitochondria are concentrated, I mean, they're everywhere in the body. They're the powerhouse of your cells. They're also concentrated in your ovaries and your brain. So if the mitochondria don't have the fuel they need, you can see brain fog. And then, of course, as we talked about previously, testosterone downregulation. If you don't have testosterone, that's also going to contribute to brain fog and feeling like you're not as sharp. And every single one of those things that I mentioned will absolutely impact your energy in a negative way.
Totally. And I know, and I personally haven't asked any questions like this because I'm sure everyone wants step-by-steps to fix this, but I can tell, or you can tell listening to this already, like there's so many impacts. Like as Dr. Jolene said, you know, there's the gut component, there's the brain component, there's the hormonal component. There is no, and correct me if I'm wrong, Dr. Jolene, 5 steps that's going to fix all of this stuff. It's very much root cause, addressing, like you say, working through your book, and you're not advertising your book, but I'm saying this, chapter by chapter, looking at these things and going, okay, this is the piece that will help this piece. Am I right in saying there is no one quick fix? Like every answer you give us, right, in a great way, is looking at multiple systems, multiple organs in our bodies. So how can there just be on the pill and expect 5 steps to get your health back again? Am I correct?
No, there is totally 5 steps.
Sorry.
Yeah, no, it's really funny that you say that because there's 5 steps in the Brighten protocol. But what you're hitting on, one of the steps is that you have to understand your hormone imbalance because it's not going to be the same for every woman. I actually designed the book. You don't have to read it from front to back. You can actually go right in and be like, here's my problems, take a quiz, understand what it is. I will lead you to the chapter to read and what the solutions are. But you know, there are 5 steps, but they cover a very holistic paradigm in that you have to understand your hormone imbalance. We have to take care of the liver. We understand that's taking a huge hit. So we have to do a post-birth control detox where we really support liver health overall, which anybody who studies nutrition knows liver is always the answer. we have to repair the gut. So gut health is absolutely essential. We have to do that gut repair piece. We have to undo the metabolic mayhem, the insulin resistance, the inflammation, the risk factors for cancer, stroke, and heart attack. Like, there are all of these pieces. So although like we can simplify it and say like there are these steps, they are very much holistic in what you're going to need to do. And, the final step is that you have to replenish your nutrient stores, which you got to get the diet dialed in, but the diet's not going to be enough. Like, you're on a medication that's depleted nutrients. You're going to have to use a prenatal or a multivitamin, something along those lines, to really replenish and rebuild those nutrient stores. So it's funny that you said there's five steps, because there are 5 steps in the Brighten protocol, but as you'll hear, and everybody who just heard that, it's not like, oh, you just eat this thing and do this thing and then everything's better. It's like there are 5 major systems that we have to be working on if we want to turn this ship around.
Well, I love structure. In my past life, I was an accountant, so I love the fact you can give us that structure of these 5 big chunky steps. So there is the structure, obviously, that you're telling us, but it's going deeper than that. It's not like eat an apple or whatever, for an example, and that's going to fix everything. It's very much like obviously digging deeper. Like, here's the 5. You've obviously given us the 5 common things that we need to deal with, that we need to make sure we've restored health to, and we're functioning really well in those 5 areas. Mm-hmm. So I love the structure, because otherwise I get all over the place and go down little like roads to nowhere. So I love the fact that you can bring us back and focus us. But I also love the fact that you are not saying that it's simply as simple as this, because how can you take a medication that's disrupted your body for so long and think that you can just fix it overnight with 5 simple steps? We've got 5 complex, amazing, well-researched, interested steps where you do have to dig deeper.
Mm-hmm.
In your book, for everyone that is on the pill, do you outline simple nutrients and like a protocol of things that we do need to be adding back into our bodies? Like, is that very well outlined as well? I'm guessing there is something.
Yeah, no, totally. And beyond the pill, there's recipes, there's a meal plan, and I go through like, here's the nutrients that are depleted, here's the foods you need to eat. And when you pre-order the book, you can go to beyondthepillbook.com. There's actually a PDF guide right away to be like, if you're on hormonal birth control, eat these foods now so that you can have that detailed. And, I recognize as, I've had so much support with this book coming out. And as you know, my son got really sick. I couldn't do all the things that I planned. And so many people came out in support of this and changing women's medicine that I put together these gratitude gifts at beyondthepillbook.com. One, I was like, okay, what do women need to know? They need to know what to eat right now if they're on hormonal birth control. They need to know about lab tests, what to be asking their doctor for so they can get things moving ahead. And they need recipes so they can implement all of this food as medicine business so that they can be successful in replenishing those nutrient stores, feeding the microbiome, helping their liver detoxify, lowering inflammation. I mean, food is that powerful.
Totally. And do you have any lasting words that you want to share with this audience today before we wrap it up and let you go eat some dinner?
Yeah, the thing I would say is that you are the only person living in your body. And that means you're the only one that knows your normal and what's abnormal. So don't let anyone dismiss that. Whether it be a doctor, your friend, someone in the media, forget them. They don't live in your body. This is not their life to live. It's your life to live. So you need to take those reins and drive that chariot like the goddess you are, because nobody's going to do that for you. And if you need to get a second opinion from another clinician, do it. Who cares if you offend that other doctor? We actually don't get offended. We recognize we're not one size fits all, but do what you got to do to advocate for your health, because you are so worth it.
Totally. And that's what I love about you, Dr. Jolene. That's your message, that we are so worth it. That all of this is about it because we're worth it. We're worth knowing our bodies and investing in that. So many women feel guilty. They want to put everything else first and everyone else first. Like, a lot of women come to me and they're like, oh, I don't know if I should pay for this. Like, should I do this? Mm-hmm. And it's like, if you don't do it, you can't live the life that you love. You can't be the best for all of these other people and everything else that you're wanting to do. But more importantly, just for you, you owe it to yourself.
Yeah, so well said. So well said.
So thank you so much, Dr. Jolene. Amongst everything else you've got going on in your life with your own family, with your negotiations with your book, what's happening, thank you for taking this time to be with us today and really share and impart your clinical pearls. You've got so much wisdom. And if you haven't pre-ordered the book, guys, you totally need to. I'm getting it all the way in New Zealand. We all need it because it's just going to be a game changer in clinic for our own clients, but also just for us, our families, and our loved ones. So thank you, Jolene, for everything you do for us as a community, and the goals that you're hitting and the message that you're putting out there. We are all so grateful, and we just really want to support you. So thank you so much.
Oh, thank you. I so appreciate that. And if it wasn't for clinicians like you, we'd stand no chance at moving women's medicine forward. So thank you so much for being here, being part of the tribe, and helping spread this message.
Thank you.